This is the Berman Method podcast featuring Dr. Jake Berman and physician assistant Jenni Berman. We are here to treat problems and not symptoms. Disclaimer, this podcast is for entertainment purposes only and not to treat anyone or to give medical advice. If you are interested in any information that we are giving and would like to use this for yourself, we recommend that you contact your primary care physician or reach out to us and ask us questions about yourself specifically. Enjoy!
We are back. The Berman method of treating symptoms. No, false. That's not right. Treating problems and not symptoms. David against Goliath. F you, Big Pharma, corporate medical system. Dr. Jake Berman here. Running solo again. Jenni Bear Berman is not with us again today, so I will do my best to keep you entertained and, wait, what is it called? Infotainment. I'm going to try to give you some information with some entertainment, so we're going to do some infotainment today. Not that I don't do that every episode, right? If I can't make myself laugh, right? Or if I can't laugh at myself, who will, right? Last week, we spoke about hip issues. Today, we're going to talk about back issues, one of my favorite things. But before we get into that part of it, we are currently booking out our PSAs, our public service announcements. I don't know if that's really the right way to call it. Our seminars, our complimentary seminars, our lunch and learns, where we come to your country club, we come to your group, and we present a topic. Both Jenni and myself do this. We do it a ton in the country club. So we're currently scheduling out for fall of 23 and then spring of 24. So if you want us to come to your country club, please reach out and put us in connection with the activities director, the fitness director, or the general manager, whoever it is. And we'll schedule a physical therapy talk. One of my most popular talks is how to keep moving and grooving pain-free, avoiding pain pills and surgery, aging gracefully is essentially what it's about. Jenni has a great talk that she's been given. And then we also have a golf talk that I'll come and present to golfers. So if any of those are interesting or sound interesting to you and you want us to come to your community and present to your fellow members that will not listen to our podcast for whatever reason, make sure you reach out now and we will get those scheduled for this coming fall and spring of 2024. Moving forward, the lumbar spine, back pain, herniated disc, bulging disc, sciatica, spondylolisthesis, degenerative disc, lumbar fusions, discectomies. I think those are probably all of the most popular ones in America. We're going to be talking about all of those today. The lumbar spine is probably one of the most over-treated part of the entire body. And what I mean by that is, in America, when you have back pain, in general, you go to your primary care and they say, here, take these pain pills, come back in 30 days if it doesn't get better. It doesn't get better. So you go back in 30 days and they say, okay, I'm going to refer you to the orthopedic. You go to the orthopedic surgeon, and the first thing that they do is they take an x-ray. Oh, yeah, I see some bulging here or some degeneration here, but I can't really get a good enough picture, so why don't you try some physical therapy? Oh, by the way, we happen to have physical therapy downstairs in our office. This is the bullshit cookie cutter physical therapist that I've been talking about for the past 100 episodes. And it's not because the PTs themselves are malicious. It's just because of the system. When you have a physician-owned physical therapy clinic, meaning that the physicians own the PT clinic, they can do things very differently than if the physical therapist owns the PT clinic, meaning that they can bill more for the same exact treatment than a physical therapist can. This is not bullshit. You can look this up. This is publicly known information. A physician-owned physical therapy clinic can bill exponentially more for an hour's worth of treatment than a physical therapy-owned PT clinic can bill. That's just one of the things. And because of that, they will crank them in, crank them out, meaning it is an assembly line. There's going to be 3 to 4 patients an hour. Get them in, get them out, bill the insurance company, get paid. It is a lucrative business. So anyways, the orthopedic sends you downstairs to their PT clinic for 6 weeks, and because that PT is seeing 3 to 4 patients an hour, they don't have the time to really analyze and assess what's going on for real. They can just treat your symptoms, and they give you a generic sheet of paper. Here, go do these exercises. If the tech has time, the tech will come over and say, yeah, that looks good. By the way, the tech doesn't have any real education on pathophysiology. Just very general exercise prescription is all the tech really knows. So the tech will not be able to tell you, yeah, the exercise looks good, but it's not 100% correct. That's what we do in our clinic is you cannot do an exercise 95% correct in our office. We won't let it happen. If you can't do it 100% correct, we will regress into something easier until you can do it 100% correct, because it has to be 100% correct. Because if it's not done 100% correct, you're hurting yourself. You're not helping yourself. So anyways, you go through this for 6 weeks with the tech, obviously not helping yourself because it's not 100% correct. You go back to the orthopedic surgeon 6 weeks later, and he's like, that didn't work, so let's do an MRI. You get an MRI, and the MRI comes back, and it says, we've got a herniation here. We need to go in there and just clean it up. Or we need to do an injection. Let's do an epidural. Oh, yeah, that sounds good. Let's do an epidural because then we can just numb it up. Then you won't have any pain at all. Or even better, let's send you to pain management, who happens to be our partner, and cauterize the nerves. Literally, they go in there and they will burn the nerves so you cannot feel the pain anymore. It's like, what the hell? How did we get here? 2 months ago, my back just started hurting. 2 months later, we're talking about burning my nerves so I can't feel pain anymore. Usually by this point, the patient says, there's got to be another way. And they start searching and researching and ultimately find somebody like us, somebody that's willing to actually analyze them and assess what's going on and figure out that, yeah, you do have some problems with your lumbar spine. But the reason why you have problems with your lumbar spine is because your core and your glutes are on vacation. They are not working at all. Because your core and your glutes are not working at all of the stress goes to your lumbar spine. So no wonder it hurts. No wonder it's degenerating. I mean, come on. Think about it. This is what is the right word? The comparison. That's not the word I was looking for. This is the comparison that I like to give people. If you ever go to the butcher shop, you know what a tenderloin looks like. It's this long, tubular, relatively skinny piece of meat in comparison to the rump. You go and you look at the rump, that's the ass muscle of the pig or the cow. It's this giant, thick, you just look at this piece of meat and you're like, man, that is a powerful muscle right there. Just solid muscle. That's your glute. It is the same thing with humans. It is identical. It's the same thing. So we have that tenderloin, that long, skinny piece of meat that goes on one side of our spine and the other. We got 2 of them. That's called our paraspinal muscles. Just for simplicity's sake, just think of that. And then we got glutes. We got 2 of them. So we got 2 rumps, one on the right, one on the left. When your rump, when your butt, when your glute is not working, then that little skinny tubular muscle, your paraspinals, has to do all the work. And it can't. So when it can't, it's going to rely on the support of your spine. So it's going to wear down your spine versus wearing down muscles. You're supposed to be wearing down muscles, not your spine, because your muscles can regenerate in 24 hours. If you wear down your spine, it doesn't regenerate in 24 hours. It might not regenerate ever. So you don't want to wear down your spine. So now we say, okay, our x-ray says we've got some degeneration at this level, and the MRI says we've got some herniation and some bulging at this level in your lumbar spine. We never even touch it. To be quite honest, I cannot even remember the last time I touched somebody's lumbar spine area when they came in for back pain. Seriously, I cannot remember. I think maybe it was when I was working in Jacksonville, just because we were training. He was my mentor up there, was teaching us how to do some lumbar mobilization and looking at things in the lumbar spine. I don't know that I've done it in 5 years, though. I mean, I really don't know that I've ever touched anybody recently in the past few years in their lumbar spine. When somebody comes in with back pain, I'm going straight to the glutes, straight to the core. Let's get the glutes firing. Let's get the glutes freed up and then firing, and then get the core firing and build up the endurance in both the glutes and the core. Their back pain magically goes away. Just magically, like abracadabra, snap my fingers, gone. Here's the best part about it, is that when people come in at an 8 or 9, sometimes 10 out of 10 pain, and then fast forward 3 to 6 months later, and they're at a 0 out of 10 pain, and they're golfing 3 to 4 times a week, or they're bending over and they're picking up grandkids, or they're walking on the beach, or they're gardening again. We can take those same people and go do another x-ray and another MRI, and I would put money on it that they look almost identical to the x-ray and the MRI that was taken previously when they were in very intense pain. And I tell you that to reiterate the fact that x-rays and MRIs are only tools. They are only meant to be used as a tool to help you make the right diagnosis. They are not the end-all be-all diagnoser. My MRI says I have a herniated disc, so that's where my pain's coming from. Absolutely not. If the symptoms match what's on the x-ray or the MRI, then we can say they are correlated. It is very rare that we say that, yes, this is exactly what the problem is. And I say it's very rare because, seriously, we've treated thousands of people over the years, thousands of them, and they all got some variation of something. Less than 1% of the people that we've worked with over the years have something that shows up on their x-ray or MRI that 100% correlates with their symptoms and is not treatable conservatively, meaning that, yeah, it requires a surgical intervention. Less than 1%. It is so freaking rare. In the grand scheme of the population that we treat, we're talking 40s, 50s, 60s plus. I mean, we're not talking about kids now. It's different when you talk about younger people. That should mean something, right? So, in summary, the myth that we are busting today is that you have back pain. You got an x-ray or an MRI. That x-ray or MRI shows that you have a herniated disc or a bulging disc. So the myth is that is what is causing your back pain. Because that is not true. It's not. If it was true, these hundreds and thousands of people that we've worked with over the years, they would still have back pain, because I'm telling you, 6 months down the road after they don't have back pain, their x-rays and MRIs look the same. So that is a myth. And that, my friends, is the number one reason why I highly recommend that you do not get an x-ray, that you do not get an MRI when you have back pain, at least initially. And here's the reason why. Pay attention to this. Everybody needs to pay attention to this. When you have back pain, you don't know why you have back pain. You're not me. You're not an expert in biomechanics. You're not an expert in pathophysiology or physical therapy. You're not a doctor of physical therapy. I am. I know why you have back pain. You don't. So when you come in to see us, all you know is that your back hurts, and that we tell you the reason why your back hurts is because your glutes are weak and your core is weak and this ain't working and that ain't working. Let's get it working, and then the back pain will go away. Then you're like, okay, yeah. The reason why I have back pain is because I have weak ass syndrome, WAS. That's our most common diagnosis in the clinic, weak ass syndrome, and a poor endurance in my core. That's why I have back pain. And it's psychologically much easier for you to work through your back pain when you think that is your diagnosis. Because when it flares up on you, you don't freak out. When it flares up on you, you're like, oh, I need to squeeze my glutes. I need to get my core firing again. And that helps you much more quickly get back going in the right direction again when you regress or sidetrack. But if you don't know that and you go straight to get an X-ray and an MRI, it changes everything. Because there's always going to be something that shows up on your X-ray or MRI. Always. I mean, unless you're 12 years old and never had an issue in your life, something is going to show up on your X-ray. So when you leave, now you're thinking in your head, psychologically, you're going, the reason why I have back pain is because I have a herniated L4, L5 disc. So now when I'm trying, the PT, I'm trying to say, the reason why you have back pain is because you got glute weakness, core weakness. You're going, in the back of your head, you're like, man, this is, I just don't know. I mean, I think it's that L4, L5 that's giving me a problem. It's not. I'm telling you, it's not. It's so rare that I can tell you confidently that it's not. I don't care what it says. It has to match your symptoms. So then when you have a flare-up or you get sidetracked and you're in pain, it's much harder for you to stay disciplined and trust the process and say, my back flared up again. I got to get my glutes and core firing again, because you're going, it's my L4, L5 that's causing me problems. It's completely different. I'm telling you guys, I've been doing this for a long time and thousands of people. And the people that come into my office with a predetermined diagnosis because they have an X-ray or an MRI, it is much more challenging to get them back to 100% than it is people that come in without an X-ray or an MRI. I'm telling you, I've seen this time and time again over the years. To come full circle and all that stuff, I do have to say a disclaimer and say that if we go back and remember what I was saying earlier about less than 1% of the people that need surgical intervention, there are times where we're going through our objective testing and we're going, you know what, this just is not making sense. Let's go ahead and get an X-ray. Let's go ahead and get an MRI just so we can rule something out. So there are those times. I will not be shy about it at all. If I can't make it make sense, it's called the smells test. And this is one of my favorite things from school that I remember. The smells test. It's like, something just doesn't smell right here. You know, it's just not making sense. When it doesn't make sense, we're going to refer you out and say, why don't you go to the doc in the box and get an X-ray real quick? Why don't you go to the orthopedic surgeon and get an MRI real quick? Let's just make sure we're not missing something, because we don't want to miss anything, right? So there's a bunch of stuff for you right there. The myth is just because you have a herniated disc or bulging disc or whatever it is, doesn't mean that's causing your back pain. It is extremely rare that that is the case. 99% of back pain with people over the age of 40 really is because your glutes and your core are weak. Your pelvis is out of alignment. I mean, you get those three things together, it's really hard to have back pain. I mean, it just is. So make sure you send this to somebody, because statistically speaking, 50% of Americans will experience back pain at some time. So statistically speaking, 50% of you listening to this podcast right now have back pain. So great. I'm preaching to the choir here. But statistically speaking, you know somebody that's experiencing back pain and they're scared, they're lost, they're not golfing as much as they want to, they're not playing on the ground with their grandkids anymore. They think of themselves as being vulnerable or fragile and say, no, I'm not going to do that because my back might go out. Oh my God, if I had $100 for every time I heard somebody say that, I'm not going to do that because my back might go out. It's like, what? Why don't we do something to make sure that it doesn't go out? Why don't we fix it so that you don't feel fragile and vulnerable? There's no way to live your life. I'm not going to do that. My back might go out. What the? Are you freaking kidding me? So share this podcast with them. Make sure you subscribe. Let us know as soon as you can if you want us to come to your country club, and we will do a complimentary seminar and present to a group of people. So we're doing that for the fall of 2024 and spring of fall of 2023 and spring of 2024. And let us know. Next week, we should be back on track with the team, the duo, me and my co-hosts again. Have a great day and keep on keeping on, baby.
Thank you for subscribing on your social media and podcast platforms to the Berman Method. Dr. Jake Berman with Berman Physical Therapy and Jenni Berman, Physician Assistant with Berman Health and Wellness. You can find more information on our website, www.bermanpt.com for physical therapy, bermanpt.com/wellness for the health and wellness. You can also find us on social media, Facebook, Instagram, and on your podcast platform. So be sure to follow us, like us, subscribe to us. And if you would like any further information, definitely visit our website and reach out to us. You may also find our free reports on the websites as well, where you can download this free information for yourself. Have a great day.